Okay, let's talk about the various different causes of the foot drop. The Before going into that, just quickly have a look at the formation of the sciatic nerve and how it goes down into the leg, and then it become much easier to understand the different causes of the foot drop, and then trying to differentiate that. How would you differentiate clinically in between the different causes? So first, if you see that here is the front of the sacrum, you can see the from L4 to S3. So these are the various different uh, nerves that are used in the formation of the sciatic nerve, and then the sciatic nerves comes at the back, and it stays at the back of the thighs, and it goes down, and in the popliteal fossa it divides into the posterior tibial nerve and the common peroneal or common fibular nerve, which winds around the neck of the fibula, which you can see here. So it winds around the neck of the fibula, and it comes to the front, where then it goes down the leg, and then the common peroneal nerves supply the anterior as well as the lateral aspect of the muscles as well as the cutaneous supply. So any damage to the common peroneal nerve, that will lead into the weakness in the anterior compartment as well as lateral compartment muscles that are mainly involved in the dorsiflexion as well as eversion of the foot. So in case whenever this is the most common cause of the foot drop, the common peroneal nerve injury, which happens here because of the usually prolonged cross-legging, or if there is a fracture of the fibular neck, or so these are the most common causes that then cause the foot drop. And in that case, you will have the so if there is if there is common peroneal nerve injury as a cause of foot drop, you will have a difficulty in the dorsiflexion of the foot as well as eversion of the foot, and you will have the disturbance in the anterior as well as lateral aspect of the leg. Whereas in case if there is any disturbance or any damage to the sciatic nerve here, which usually occur at the back, so if there is any sciatic nerve damage, so the supply to these muscles will be affected, but along with that you will see the whole supply to the whole of the leg. So what will happen is that there will be weakness in the dorsiflexion, but there will also be weakness in the plantar flexion of the foot. There will be weakness in the eversion, but there will also be weakness in the inversion of the foot as well. So basically the whole movement of the legs, and as well as in the knee flexion, so those all of the muscles group will be affected. Whereas and also the cutaneous supply of the sciatic nerve is usually the whole of the leg, apart from the lateral aspect, which is usually supplied by the L5. So yeah, but then that will also be affected as well. So so the only so in case of the sciatic nerve damage, the whole of the leg sensory supply will be affected, apart from just on the medial aspect, which will be spared. Whereas in case of if there is any L5 radiculopathy, which normally happens when there is so basically whenever there is a disc bulge or anything that kind of presses the L5. So L5 is one of the main nerve supply that supply the muscles of the dorsiflexion. So in that case, in L5 radiculopathy, you will have the foot drop, which is the dorsiflexion. There will be foot eversion will be weaker, as well as foot inversion. So L5 also supply the inversion muscle, so inversion will also be weaker. But other than that, the other muscle groups will be fine, whereas the sensory supply will only be affected on just the lateral aspect. So just the lateral aspect is the place which is supplied by the L5 nerve root. So that is the causes of the foot drop. And in case of the foot drop, what will happen is that you will have the steppage gait, which is basically high stepping gait or steppage gait. So since these patients, if they try to walk normally, they will, since they can't really can't really dorsiflex the foot, so they will drag the foot on the ground. So in order to avoid it, what they do is either they just try to lift the knee a bit higher up, and then once they put it back, it kind of produces that slapping sounds. So that is called steppage gait or high stepping gait. Or if there is weakness, which usually occur in the patients with the stroke, so what they do is, instead of lifting the knee, they kind of just lift the hip up and bring the foot forward. Again, the whole mechanism is in order to avoid the dragging of the foot. So in that way, there is usually problem and pains in the hip as well as the back, but that's also one of the mechanism that the patient uses to avoid dragging of the foot. So if you see a patient with the slapping feet, or if there is a high stepping gait, that will tell you that the patient is having foot drop. And again, the causes could be central, such as stroke. From there, it could be L5 radiculopathy, it could be sciatic nerve damage, and it could be common peroneal nerve damage. And you will need to assess the various different causes based on the muscle group that are affected, the various different movement patterns that are affected, and the sensory distribution. That is all explained. So thank you.